Hey guys, it's Dr. Mona Gohara. Welcome to another episode of Dear Derm. Today we're going to discuss everything you need to know about psoriasis. Psoriasis is the overgrowth of the top layer of skin cells in the epidermis. It's thought to be brought about by an immune reaction in the skin. Psoriasis is super common, affecting about 8 million Americans. I see psoriasis every single day in my office. There's plaque psoriasis, which is red scaly plaques on the skin. There's guttate psoriasis, which are little kind of raindrop patches on the skin. There's pustular psoriasis, which commonly affects the palms and soles. And then there's also inverse psoriasis. And inverse psoriasis is where you can get red rashes in your armpits, groin, or under the breasts. Now, psoriasis can happen at any age, believe it or not, from birth up until an elderly age, because we don't really know what causes it. All we know is that it's an immune-mediated condition. So if you've been diagnosed with psoriasis, there's a couple of important points that we need to be aware of. The first of which is that it's not curable, but it's certainly treatable. So there is no reason for anybody to be walking around with a skin condition that makes them feel uncomfortable. There are many treatment options. When considering treatment for psoriasis, we have to consider a lot of things. How long the patient has had it, how much psoriasis the patient has, have they had previous treatments before, do they have arthritis or other things that can be connected with psoriasis. But what we usually start with, if somebody has just a couple plaques of psoriasis on their body, we usually start with topical anti-inflammatories, the most common of which are topical steroid ointments. These are anti-inflammatories that help to bring down the scale and any irritation that is associated with psoriasis. In the past 20 years, there's been so much exciting science surrounding psoriasis and its treatments. The most exciting of which, no doubt, has been the development of biologics. Biologics are tiny proteins that are actually cultured from human cells in a laboratory that stop the immune reaction that's happening in the skin so they can stop psoriasis before it happens. To me, that's what science is all about. The reason that many of my colleagues prefer biologics for treatment of psoriasis is because they're extremely efficacious at putting the patient in remission, extremely efficacious at changing the patient's life significantly from a physical and mental perspective. When it comes to skin conditions like psoriasis, sometimes we encourage sun exposure. We actually have light boxes in our office of ultraviolet B called narrowband UVB boxes, where we will give a patient a prescription to get in the light box to help with the inflammation associated with psoriasis. Now, this is often prescribed for people who have larger areas of psoriasis that it's just too hard to slather on a cream or an ointment. Next, there are oral medications that we can use to treat psoriasis. Again, this may be used in a situation where somebody has pustular psoriasis on their hands and feet. That has a tendency to be a bit more tricky to treat. So it's extremely important to maintain a very gentle skin routine. So when it comes to how to take care of your skin with psoriasis, gentle cleanser in the morning, I still recommend. The good news is about psoriasis is it has a tendency not to affect the face, which is a saving grace because a lot of people can be spared having to deal with inflammation on their face. Towards that end, I do recommend patients with psoriasis can continue on anti-aging routines if they so desire. I'm a big fan of vitamin C, that's no secret. We talk about it on Dear Derm all the time. And of course, we want sun protection before you leave the house. So a broad spectrum SPF of 30 or higher on your face and your hands daily is essential. And then at night, before bed, again, cleansing the skin with a gentle cleanser. Using a retinoid if your skin is not inflamed is okay. And then a nice heavier night cream just to make sure that your skin is hydrated. If you are experiencing a lot of inflammation or any inflammation on your face with psoriasis, I would say during the flares until it subsides, it's probably best to just stick with gentle cleanser and moisturizers until the flare is gone. Remember my motto, it's not just about the face. You have a whole bunch of skin below your neck. So let's talk about body care for a second in a patient with psoriasis. Now, when people have thicker plaques on their skin, use of an alpha hydroxy acid such as lactic acid or a urea-based product can really go a long way to help to get those scales off the skin. Remember, it's not a scrub, it's really just kind of a gentle exfoliant. Now, I don't think it's really effective to just randomly exfoliate the body because you can get what's called the Kebner phenomenon. The Kebner phenomenon is when psoriasis comes out in areas of trauma. So the more you scrub, the more likely you are to get a flare of psoriasis in that area. So keep it simple. Cleanse, use a gentle exfoliator over the plaques if need be, and moisturize, of course, every night. There's a great product called Eucerin Advanced Therapy that has a smidge of exfoliators in it that's a nice compromise between total exfoliation and just moisturizing. I think that would be a very nice choice with somebody who has psoriasis on their skin. Just like any other inflammatory skin condition, it's important that you're eating well, sleeping well, exercising enough. That just contributes to your overall skin health. If you think you have psoriasis, you don't need to live with it. Just go make an appointment with your local board-certified dermatologist because there's a lot of great treatment options that can make things a lot better for you. Thank you so much for joining me on another episode of Dear Derm. Leave any questions below and don't forget to subscribe to Well+Good. See you later.